Gentlemen, if you're a man over 60 and looking for a natural way to improve your erectile strength and overall vitality, it is important to know that there are simple steps you can take that truly make a difference. Many men assume that the only solutions are quick fixes, medications, or invasive treatments, but in reality, the human body responds very well to consistent, science-backed training. As a urologist, I can tell you that one of the most overlooked yet powerful ways to improve your intimate health lies in strengthening your pelvic floor muscles. These muscles play a crucial role in bladder and bowel control, prostate health, and especially erectile function. With age, it is normal to experience some decline in firmness, stamina, and confidence. But decline does not have to mean defeat. The truth is, you can reclaim a great deal of strength and control simply by practicing a short routine daily. This routine takes no more than 3 minutes and, when performed consistently, can help restore confidence, improve blood flow, increase control, and enhance sexual satisfaction well into later life. First, let us understand why these muscles matter. The pelvic floor muscles stretch like a supportive sling from the pubic bone at the front to the tailbone at the back. They are the hidden foundation of male pelvic health, working silently to support the bladder, stabilize the prostate, and assist in the mechanisms that make erections possible. When these muscles are weak, blood flow is not as easily maintained, nerve sensitivity may decrease, and men may experience issues such as urinary leakage, reduced firmness, or premature ejaculation. When the muscles are strong, however, they act almost like a pump, trapping blood in the penis during arousal by compressing the veins that would otherwise allow it to escape. This process, known as venous occlusion, is absolutely essential for sustaining a firm erection. A weak pelvic floor allows blood to escape too quickly, while a strong one ensures fullness, rigidity, and longer-lasting performance. In addition, improved tone in these muscles enhances nerve responsiveness, meaning better sensations, more control over climax, and a greater sense of confidence during intimacy. The good news is that strengthening these muscles is not complicated. The 3-minute daily routine is built around what are commonly known as Kegel exercises, though for many years they were primarily recommended to women after childbirth. Today we know without question that men benefit just as much, if not more, from these same exercises. They are safe, easy, and can be done anywhere without anyone knowing. The first step is identifying the correct muscles. To do this, imagine trying to stop the flow of urine midstream, or imagine holding back the urge to pass gas. The subtle lift and squeeze you feel deep inside are the pelvic floor muscles. It is crucial to isolate them correctly because using the wrong muscles, such as the thighs, buttocks, or abdomen, will not deliver the intended results. The movement should feel like an upward pull inside the pelvis, not a downward strain. Once you are confident you can locate these muscles, you are ready to begin the simple routine. The exercise consists of 3 parts, each lasting about 1 minute. The first part is called the slow hold. Begin by gently contracting your pelvic floor muscles and holding the squeeze for 3 to 5 seconds. During this time, focus on the lift and squeeze, not clenching your breath or tightening your stomach. After holding, relax completely for the same length of time. The relaxation is just as important as the contraction because it allows blood to circulate and the muscles to reset for the next squeeze. Repeat this cycle 10 to 12 times, and you will begin to build endurance and control. The second part is called the quick flick. Here, you rapidly contract and release the muscles, almost like flicking a switch on and off. Continue this rapid motion for about a minute, always ensuring you release fully after each squeeze. This builds responsiveness, speed, and the reflex control needed for stronger erections. The third and final part is the endurance hold. This involves contracting and holding for as long as you comfortably can, ideally starting at 10 to 15 seconds and increasing gradually as you become stronger. After each hold, relax fully before repeating. Do this 3 or 4 times within the final minute. These 3 steps complete the entire 3-minute routine, and when practiced daily, they steadily transform pelvic floor strength. The science behind the benefits is straightforward. Stronger pelvic floor muscles increase the efficiency of blood trapping in the penis during arousal, leading to firmer, longer-lasting erections. They also improve nerve sensitivity, which enhances both control and sensation. Over time, men who consistently train these muscles report fuller erections, greater satisfaction, and increased confidence in intimate situations. The benefits extend beyond sexual performance. A well-conditioned pelvic floor also supports bladder control, reducing issues such as leakage after urination or sudden urgency. Many men also find improvement in premature ejaculation, as they gain greater voluntary control over the muscles that influence ejaculation. All of these improvements contribute to a sense of vitality and self-assurance that positively affects not just intimacy, but overall quality of life. Of course, as with any form of exercise, there are mistakes to avoid. The first mistake is bearing down instead of lifting up. Pushing down places unnecessary strain and can actually weaken the muscles rather than strengthen them. Always think of lifting upward and inward. The second mistake is holding your breath. Breathing naturally is essential because holding the breath creates abdominal pressure and interferes with the effectiveness of the exercise. The third mistake is accidentally engaging surrounding muscles such as the abdomen, thighs, or buttocks. While those may tighten naturally, the goal is to isolate only the pelvic floor. If you feel your stomach or buttocks straining, reset and try again with a lighter, more focused squeeze. The fourth mistake is overdoing the routine. More is not always better, and overtraining can lead to muscle fatigue or discomfort. The 3-minute daily routine is more than enough to build lasting strength when practiced consistently. Finally, it is important to remember that while pelvic floor training is powerful, it is not a cure-all. If you are experiencing persistent erectile dysfunction, severe urinary problems, or pain in the pelvic region, consult a doctor. These symptoms may signal underlying conditions such as cardiovascular disease, diabetes, nerve damage, hormonal imbalance, or prostate issues that require professional evaluation. When approached correctly, this 3-minute daily practice becomes a long-term investment in your health. Unlike quick fixes, it works gradually, building true functional strength that supports both intimacy and daily life. Think of it like strengthening the foundation of a house. Once the base is solid, everything built upon it performs better and lasts longer. Combined with healthy lifestyle habits, the benefits multiply. Eating a balanced diet rich in whole foods, maintaining cardiovascular fitness through walking, swimming, or cycling, getting quality sleep, and managing stress all work together with pelvic floor training to keep your body performing at its peak. Strong muscles, healthy blood vessels, balanced hormones, and calm nerves are the ingredients of vitality, and every small action you take builds toward the larger goal of long-term well-being. It is also important to note the psychological benefits. Many men over 60 feel discouraged when they notice changes in erectile function. This frustration often leads to a loss of confidence, withdrawal from intimacy, or even strain in relationships. By practicing these exercises and experiencing improvements, men often regain a sense of control and optimism. Confidence in intimate settings spills over into other areas of life, improving mood, energy, and overall self-respect. Taking active steps to care for sexual health is not only about the physical results, but also about the powerful psychological shift that comes from knowing you are doing something effective for your body. In conclusion, while aging naturally brings changes, it does not mean losing vitality or strength. The pelvic floor is a small but mighty group of muscles that hold the key to improving erectile quality, bladder control, and sexual satisfaction. By dedicating just 3 minutes a day to the slow hold, quick flick, and endurance hold, men can experience profound improvements over time. These exercises are discreet, easy, and free, yet their impact is enormous when practiced with consistency. They offer a science-backed way to take control of your health without relying solely on external solutions. For men over 60, they represent an opportunity to continue enjoying intimacy, strength, and vitality for many years to come. 3 minutes a day is a small investment for such a meaningful return.